Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Welcome to another episode on the Brain People Podcast. By now, you should know my voice and the voice that's going to join me shortly. But in case you don't, or you're new to this show, my name is Dr. Katie Cruz. I'm a licensed clinical psychologist, your host for today. And joining me is
Jonathan Eanes. I'm a psychiatric PA, and I'm also one of the regular hosts on this show.
Yes, we are two of your four brain people. Now, today we're going to be talking about a more specific topic. Sometimes our topics are broad, but I love that as we have more and more episodes, they're getting more and more focused. And even with some of these topics, things that not even within mental health or even some mental health professionals talk about. And what you'll notice with all these episodes, and including the one today, is mental health is pretty complex. And there's a lot of different things that contribute to our mental well-being. So today, we're going to be talking about vitamins and minerals and their impact on our mental health, and especially emphasizing the importance of testing for them and making sure that we're aware of these things impacting our mental well-being. And this will be a part two. Today will be the part one, but it'll be a two-part series. And so you'll want to stay tuned for the part two as well. So why don't we just jump into one that I know I love to learn about and the importance of the vitamin D.
Before, if you don't mind, we jump into that. Yeah, let's if you wouldn't mind, we can talk about maybe the reason behind why I chose this particular topic. So basically, I was thinking, what to choose for today's episode, and we've talked a lot about nutrition. We've had a few episodes dedicated specifically to nutrition, and then we've also just sort of broadly or sort of offhand talked about a lot of maybe dietary patterns and things of that nature that people can do for their mental health. But I don't believe we've had an episode talking specifically about certain nutrients. Another thing that we've talked about was supplementation, right? But in the nutrients, in the vitamins and minerals that we're going to talk about today and during the part two, the thinking was more so what nutrients can you actually get tested, and typically get tested through insurance. Some of these specific vitamins and minerals, will often be completely covered by insurance, and it's something that you could even say request from your primary care or your psychiatrist to see if there is a deficiency and if it needs to be addressed. Now, all of these vitamins and minerals do have some established sort of association with mental health disorders and or outcomes. So that was ultimately sort of the reason behind the ones that I chose.
And that you're actually doing in your own practice, which I appreciate, and something that I want to advocate. And sometimes I do try to push all my clients. I wish they could do this kind of testing because there are some things that we don't realize. We might be working harder in therapy or working harder on our mental health, and it might be something related to our vitamins and our minerals and nutrients. So glad that we're doing this episode. Okay, so now are we ready for vitamin D?
We are ready for vitamin D. So vitamin D is, just as a general overview, it is a very important molecule. It's something that regulates bone health, immune function, and it's also been implicated in mood regulation and mental health. So deficiency has been associated with various psychiatric disorders. Most people have probably heard of vitamin D. Many people have been told they need a supplement with vitamin D. Many people, especially if they live, we're sort of blessed. We live in California, and so there's much more sunshine here. And many of us do get our vitamin D from the sun. But even many places in the United States, if you live at certain altitudes, or if you live, in certain states, right, where there's much less sunshine or much more cloud cover, then it can be very difficult to get your vitamin D exclusively through natural means. And so it's an important thing to be aware of, especially if you are somebody that deals with mental health conditions.
And I know that we're recording this right now as we're approaching winter, but who knows when it's going to be released. But I think that's when people often think about vitamin D deficiency and the winter blues, and even people who may not have seasonal affective disorder, they can still feel the impact of the sun and vitamin D on our mental well-being.
Yeah, and I would suggest that just because winter is coming up doesn't mean that's the only time that you should be testing for this, because it's quite surprising that even here in Sacramento, where there's a ton of sun, how often I see a vitamin D deficiency. And so it's just very, very common for a number of different reasons, even in sunshine states, so to speak. So for many people, especially if you're prone to it, or you are not getting your vitamin D, say through fortified foods or supplementation, then it is probably something that you do want to make sure is being included in lab work on an occasional basis, especially if there's a symptomatic reason to suggest like an underlying mental health condition.
And you just mentioned, obviously the sun, and then you mentioned fortified foods. Someone saying like, how do I make sure that I get that vitamin D? What are different sources?
Yeah, so the sun is arguably the best state and the most natural state, but there are some downsides to that as well. Not everybody has access to enough sun exposure throughout the year. There's also drawbacks to excessive sun exposure, and so we'll talk about a little bit later what sort of the optimal range is going to be for different individuals in the population, but vitamin D is predominantly produced when you're exposed to ultraviolet B radiation. And so that's going to be most prevalent like midday sun, which, has, like I said, has its drawbacks in terms of sunburning, skin aging, things of that nature. So a lot of people do choose to either get it through supplements, or they consume, say, fortified foods like mushrooms that do include it naturally. A certain milk and non-dairy milks also are typically fortified with vitamin D. Some cereals, fortified orange juice does include it, and then certain fatty fish they do collect vitamin D in their tissue. So this would include things like salmon and sardines, amongst some other fatty fish as well. But those are the ones that come to mind.
And then supplements, right? That's a common source.
Yeah, supplements are often going to be the preferred method that we use, typically, at least from a clinician standpoint, because it is something that every insurance company is going to cover, especially if you do have lab work that shows a vitamin D deficiency. Even if you don't, most of them are still going to cover it. And so if you are taking a vitamin D supplement, it might be worth even asking, like, hey, if you can get that prescribed, because you might be able to get your insurance company to actually cover the prescription. And we'll also talk, here in a minute, just about different doses we'd want to use. But I did want to mention real briefly, as we're going throughout this, that I'll be citing some specific studies to sort of prove this point. But a specific study by Ganji and others, and this was in 2015, they found that blood levels of 12 nanograms per milliliter or below had significantly higher likelihood of depression than those with a level of 30 nanograms per milliliter or higher. Now, I know most of our listeners might not be familiar with what the typical range is, but the recommended range is going to be that 30 nanograms per milliliter or higher. So usually when you're below that 30 is when we're going to say you either have an insufficiency or a deficiency. So if you're 20 to 29 is when you've got the insufficiency, and when you're below 20 is when we're going to say you have a deficiency. So as I said, this particular study saw that 12 and below specifically had a much higher likelihood of depression. And so, if you are generally kind of a more sensitive person to this particular problem, you might even have significant worsening of depression, even at those insufficiency ranges. You may not need to get down to 12 in order to actually manifest symptoms of depression as a result of low vitamin D.
So since we're already talking about that, of like the impact of deficiency, so you mentioned depression. Is there anything else you want to comment about depression, of the impact of vitamin D deficiency on mental health?
I mean, not necessarily. It's for many people, if it is the sort of primary cause of their depression, it's going to be difficult to really rule that out, generally speaking. But if somebody responds very well, and especially if they are more consistent, or I should say their clinical manifestation is more of that seasonal affective. And for those that don't know, seasonal affective predominantly is the development of depression during winter months. Now, that's not always the case, but that is the much more likely way that people present. And so, the research when it comes to mental health and vitamin D does tend to focus on depression. There is some evidence in other types of mental health disorders, but it's just not as well established as it is for major depressive disorder and seasonal affective disorder.
So how do we go about getting tested, and what test is there?
So a couple ways that you can go about doing that. One is you just ask your provider, whether that be your primary care, whether that be your psychiatrist, or maybe even say like your OBGYN. Right? I know a lot of women in particular, they tend to see their OBGYN much more often than they see some of the other providers. And it is relevant to that as well. So that would be one that you could ask. You could also pay for it out of pocket if you really wanted to do that. I know some people, maybe they have a high deductible plan, and rather than going and seeing their provider and paying the bill for the appointment plus the second sort of appointment to get the results back, it might just be worth it to go get it done. I'll mention this now because we're talking about testing. There's a really good resource. It's called Jason Health, and Jason Health is essentially like GoodRx for medications. So they basically give you heavily discounted cash pay prices, and you can get you can use like a Quest Diagnostics in your local area. And for vitamin D specifically, it's $45. So it's not going to break the bank. And then there's like a lab testing fee on top of that. So it's a relatively inexpensive test to get it done if you wanted to get it done periodically, just to monitor your own levels. Highly recommend to do it alongside your provider, but I realize not everybody necessarily has that luxury. And just to be clear, that $45 is actually, I think, the most expensive test that we'll talk about today. So many of the other ones are actually going to be less expensive than that if you wanted to do it on your own. So that's going to be jasonhealth.com. So getting it done through your provider or through a service like Jason Health, those are probably the best ways to go. I'm forgetting if there's a second part to your question, Katie.
No, I mean, I know you wanted to talk about testing method and just a broad about testing, and kind of you answered the practical steps of like the initial things to do. But yeah,
I mean, very, very straightforward, just like any other blood test, right? You're just going to go. They're going to draw blood for this particular test. They'll run it through the lab, and then usually you'll get results within a few days. I did want to mention, in terms of, we've sort of alluded to treatment options, right? But to be a little bit more specific, there are a couple different types of vitamin D. Oftentimes people will see vitamin D2 and D3. It's pretty much universal at this point to get the D3 in terms of both recommendation. I very rarely see vitamin D2 anymore. And so vitamin D3 specifically is known as cholecalciferol. So that's the other name for it. And this one has just been shown to be more effective at alleviating the vitamin D deficiency than the other form, the vitamin D2 form. So without giving any specifics, because if you are deficient, it is important that you take, something within a particular range. And on the low end, that might be somewhere between, say, 800 to 1,000 international units per day. And on the very high end, if you have a severe deficiency, you often see 50,000 international units per week, right? So different providers might give different recommendations based on the level that you have. And so, in my own case, I'm going to be far more likely if somebody's say in the high 20s in terms of their number, I'm going to be on the lower end versus somebody that has, say, a 10, right? There's going to be a much greater degree of difference in terms of the recommendation. And then another thing, because vitamin D is fat soluble, it's not something that you just easily sort of urinate out if there's too much of it. And so it does have the potential to build up in your system. And there is an understanding that if you have a certain serum level that's above a particular threshold, that it can become toxic. And so for maintenance level, it's generally not recommended to exceed 4,000 to 5,000 international units per day after the deficiency has been treated. Because this can lead to things like having too much calcium in your system, nausea, vomiting, weakness, and even kidney damage if sustained for a long period of time. So aside from supplements, though, there are vitamin D-rich foods, which we mentioned already, and then of course, going to the specifics of sun exposure. Generally, the recommendation is going to be you want more surface area of skin exposed, right? So the more, the better. And so generally, about a third or so of the body is kind of a good rule of thumb, to where you can be modest while simultaneously having enough skin exposure to get the job done. So this would look like something like shorts and a tank top, for example. And for fair-skinned individuals, somewhere between 10 and 30 minutes of midday sun exposure, 2 to 3 times per week, is typically going to be sufficient for vitamin D needs. If you do use sunscreen, that will limit the amount of vitamin D that's able to be produced. Even those lower levels, like an SPS of 15 or 30, can decrease vitamin D synthesis by like 90+%. So it's a good idea if you are very sensitive, or maybe you're trying to just keep your face from being exposed, then you can wear a hat, you can wear sunscreen on your face, but maybe the rest of the body should be exposed for that time frame. For darker skinned individuals, you may need a longer exposure time. So this might be upwards of 30 to 45 minutes during your sessions a couple times a week. And this is because melanin, which produces the pigmentation in the skin, reduces people's ability to produce vitamin D. And one of the key aspects of getting sun exposure is you do not want to burn, right? That's not the goal here. And I'm saying this as much to myself as anybody else, because I tended to avoid sunscreen, especially when I was young. And so I'd allow myself to burn more often than I'd like to admit. But in terms of vitamin D, in terms of finding a balance between getting the vitamin D necessary while simultaneously not producing excessive sort of inflammation and sort of aging effects of the sun, you definitely want to make sure that you're not burning. So that's about all I have to say about vitamin D without getting into too much detail. Did you have any other questions, Katie, on that?
I hope that none of our listeners are thinking this, but just in case, what if someone thinks, oh, okay, with supplements, if I'm deficient, then I need more, right? A higher dosage. I don't know if they'll think this, but in case they do, I'll throw it out there. What if someone thinks, okay, then I need more sun? Does that apply as well? I know that we have the caution of burning, but does that also work in the same way?
There's a balance there, right? And so for some people, depending on a myriad of factors, right? Depending on depending on where they live, in terms of their altitude, or how close they are to the equator, how much cloud exposure there is, maybe there's sort of general skin pigmentation, the medications they're taking, any comorbid skin conditions. There's a lot of different factors, right, to consider. And so if somebody is following that general recommendation and yet they're still not achieving adequate levels of vitamin D solely, then it's probably at that point best to look into supplementation. Because, like I said, I think for most people, overdoing it, especially with the sun exposure, is not necessarily going to be the optimal way to go. It's also, it is also time consuming. And so a lot of people, especially if they have regular, if they work a fairly regular schedule, it might be difficult to get out there in the middle of the day and get the extra time that you would need in order to compensate for maybe your body's inability to produce it with simply sun exposure. So it might need to be a multi-pronged approach, which is often what I've done with my patients. They might be more inclined to do the sun exposure during the summertime, and then they'll supplement during the wintertime. And maybe, if there is some sun on a nice day here and there during the winter, they can still go out and try to enjoy it without worrying too much as they're taking their supplement as well. And it is a moving target, right? And so it's also important to get regular repeat tests because, for example, if you're taking the 50,000 international units per week, generally you're going to want to do that for maybe a couple months, 2 to 3 months, and then you'll retest and see where you're at. And if you're within the normal range, then you back down significantly, maybe to more of a maintenance level, or you stop altogether, and then you wait maybe a few more months and you can test again to see if those numbers have changed depending on where you landed. So it's important to be vigilant and educated, about making sure that you're basing the decisions you make off of the data that you get from the testing results.
Okay, well, let's move on to the second one that I know that I have spent a lot of time looking into as I eat a plant-based diet, but vitamin B12.
Yeah, this one is especially important for those that do eat a vegan or vegetarian diet. The predominant sources of B12 in America are going to be from animal-based foods. So B12 though is important for a number of different reasons. Its role in health includes a wide variety of functions, including nerve function, red blood cell formation, and the making of DNA. It's also crucial for the production of neurotransmitters. So this would include things like serotonin and dopamine. B12 is an extremely cheap test. So basically every insurance, I really highly doubt that there'd be an issue in getting that covered. You could do a combination with Jason Health of both B12 and folate, which we'll talk about next, for like $30. And I think the B12 by itself is somewhere between like $5 and $15 on its own. So very, very, very reasonable. And for those that do have symptoms of deficiency, or maybe that have certain diets that would generally preclude them from getting B12, like vegan diets, or maybe you've been told you have something like pernicious anemia before, and so it's just something that you need to be more aware of and be testing for. There's a number of different options there. So in terms of normal, sort of the normal recommended range, typically it's going to be above 200. That is going to be the low end of normal, and then that usually I'll see somewhere on kind of the upper end between like 800 and 1,000. But oftentimes, even if you're in that 200 to 300 range, while you may be considered normal, we often would suggest that you should probably be supplementing, as that's indicated to be a borderline deficiency.
Yeah, I was just looking at these numbers and my mind started going. I just got my labs done too, and I was like, "Oh, my levels are high on that one." Little sidetrack.
I'm assuming you supplement.
I do, yeah, and then I
Yes.
do a lot of nutritional yeast too. So.
There you go. Perfect. So just to add to some of the potential symptoms that you might be seeing if you are dealing with B12, the one that most everybody thinks about is energy, right? And so they think, oh, I'm going to get my B12 injection. That's going to give me a lot of energy. And so fatigue, definitely, if you are dealing with fatigue, worth looking at your B12 level to see if maybe that is low, and that could be solved through a simple injection of B12 or through supplementation. If you're dealing with weakness, or if the deficiency is more pronounced and has been more persistent, you could potentially deal with like a neurological issue. This could include things like tingling or balance problems. Even cases of like confusion and significant mood changes are also associated with B12 deficiencies. There are some studies that do suggest that B12 deficiency can be linked with increased risk of depression. Now, the study that I did look at, this was by Lochner and others in 2012, and they specifically looked at older adults. And in this particular paper, they provided an analysis of the impact of unique risk of B12 deficiency in older patients. And they suggested a few kind of interesting things to consider. But those higher risks in the older population may be due to a few factors, including things like decreased stomach acid production, right? So the stomach acid helps us absorb B12 through the gut lining. And so as you get older, oftentimes stomach acid production does tend to decrease. Dietary insufficiencies. So if you've got a particularly restrictive diet, or you're just say eating less as you get older, as a lot of people do, then you're going to be more prone to a B12 deficiency. And And then there are certain malabsorption disorders and certain medications that are often common in the older population, such as proton pump inhibitors. So this would be like Protonix, for example, very popular prescribed and over-the-counter medication, or metformin, which is used for diabetes. These can reduce and inhibit the absorption of vitamin B12.
So I go get tested, I'm low. What are my options for vitamin B12?
So there's a couple options, and this is probably not necessarily something you need to worry about, but cyanocobalamin is a synthetic form, and methylcobalamin is the active form of B12. You're typically going to see the synthetic form more so in certain supplements and or like multivitamins, especially. It is a cheaper form, but it's not necessarily a bad form just because it is synthetically produced. In many people, it can absolutely fix their deficiency, but there's definitely an argument for the methylcobalamin in many cases being better. It does provide that methyl group, and so if you do have a methyl issue with MTHFR, that may be beneficial. It is argued to be a more absorbable form. So if you have issues with absorption, or I should say if it's suspected that there's absorption issues causing your deficiency, then that may be the more preferred form. But ultimately, it's going to come down to maybe what's available to you, what the prescriber gives you, whether they want to do the oral or injectable. There are also like dissolving ones or sprays that you can get that people do suggest have better absorption because you are bypassing the stomach acid and the interior lining by absorbing through the mouth. And then the last research reference that I'll make is a study by Sengel and others, and this was in 2022. It was titled Vitamin B12 Supplementation, Preventing Onset and Improving Prognosis of Depression. And they essentially concluded that vitamin B12 supplementation could be an effective strategy for both preventing the onset of depression and improving the prognosis in those already affected, especially when combined with standard treatment. So in this case, they were using adjunctive B12 with sort of typical antidepressant therapy, and they found greater improvements than just using the antidepressant alone.
And I really appreciate that it highlights even preventing the onset, right? Because some people may be listening and maybe they don't have a current mental health disorder, but it's even thinking about all of these, not just this vitamin, but all of them really of like, how do I make sure I'm taking care of my body, my health, my brain in a way that I can also prevent the onset of something.
Yeah, absolutely. If our listeners haven't gathered, we're very into preventative medicine, right? And so the nutrients, the vitamins and minerals that we're talking about in this discussion, alongside so many of our other strategies, are really about not only the treatment of, say, active and acute issues, but also preventing future issues, because we know that these tend to be, chronic diseases, and so if we can keep, say, episodes of depression, for example, from maybe in your specific case, we may not be able to keep them from ever happening again, but maybe we can prevent them from becoming worse or more frequent, or your recovery time can be faster if they do occur, right? So there's a number of different ways about thinking about prevention, and it's not always the complete absence of the symptoms ever again.
And I also like to mention to my patients of like, because mental health is so complex, sometimes you can think about these individual things like reducing by 1%, right? It's like 1%. And so you're trimming the fat where sometimes they get overwhelmed. There's so many things. Yes. And the more and more that you take care of these smaller things, they can really add up to be bigger things. So awesome. Okay. Our last one for this first part, let's talk about folate.
Yeah, so folate is also referred to as vitamin B9. Many people are familiar with folate in the context of pregnancy, right? So many women are told to incorporate some sort of folic acid supplement while they are pregnant in order to minimize neural tube defects or other neurological conditions that can come with being folic acid or folate deficient during pregnancy. And so, it's fairly obvious, sort of based on that understanding, that folate and deficiencies, even in adulthood, can be associated with neurological issues or psychoneurological issues. And so folate, to be a little bit more specific, it is essential for DNA production, repair, and what's called the methylation process. It also plays a critical role in just overall brain health and mood regulation. So to just mention methylation, I know I briefly mentioned it during our discussion on B12 and the methylated form of B12. But that methylation process is involved in things like gene regulation, which just looks at your DNA and how those specific genes on the DNA strands are being expressed or suppressed, if you will, right? It's also involved in things like detoxification, neurotransmitter production as well, and then something called homocysteine, which is a byproduct of certain metabolic processes that are considered to be where this particular molecule is considered to be problematic for a number of different reasons. And there tends to be higher homocysteine levels in those that have more depression and those that are deficient in things like folate and B12. And then that methylation process is also involved in energy production and immune function. So folate primarily comes from plants. So unlike B12, right, we get sort of the opposite here. And often those that do tend to be deficient in folate don't tend to eat a very healthy diet, or maybe they don't eat a healthy diet and they're also not eating foods that would otherwise be fortified in folic acid. And so this would include things like leafy greens, spinach, kale, etc., right? Legumes, so beans, split peas, lentils, fortified cereals, and citrus fruits in particular are going to be higher sources of folate. Now, you will find folate in other plant-based foods, but those are the ones that tend to be, on sort of a percentage basis, a little bit on the higher end of things.
Kind of interesting how these are on opposite kind of scales here of the foods, but testing, is there any differences between, this and the other tests that we talked about?
The only real thing about this is that there are a couple different tests that you can get. The serum folate level, the typical range for that is going to be between 3 and 20 nanograms per milliliter. And then a slightly more accurate test for looking at long-term folate status would be what's called the red blood cell folate test. And then the normal levels for this are going to be between 140 and 628 nanograms per milliliter. So sometimes you'll see one ordered or the other ordered. Sometimes you'll see both ordered. It can be useful to have both. But if you can choose one, then you'd be more inclined to want to get the second one for the long-term folate status.
What does long-term status mean?
Just like have you changed your diet recently, and sort of have you been substantially increasing your overall folate intake, right? Similar to how we might look at NA1C with diabetes, right? I could either get a sort of snapshot of your blood sugar levels in that moment, or I could look at the average of months. So that would be sort of a similar analogy.
Okay. Now I know you talked about like the importance of this vitamin, which you can deduce obviously as well, like the impact of the deficiency, but specifically for mental health, what is the impact of a deficiency with this vitamin?
Yeah, particularly mood disorders and cognitive decline are the things that we have kind of the most robust evidence for. And even, that being said, like relative to some other supplements, it's not as necessarily as robust that I'd like it to be. I'd like there to be more research with all of these vitamins. But we have to work with what we have. But there is definitely convincing evidence that if you have a deficiency, that you're more inclined to, or I should say you're at a greater risk of things like depression and cognitive decline. And if you supplement appropriately or eat foods that are high in folate, then you can alleviate either symptoms or prevent those symptoms from occurring. So some of the ways that you can treat if you are found to have a deficiency is with either folic acid, as we talked about, or the activated form called L-methylfolate. And then dosages of both of those are going to vary just based on your individual needs and the severity of the deficiency.
Is there any pros or cons for choosing either one of those?
Yeah, I'd say the evidence for depression, especially as an adjunct, is a little bit stronger for L-methylfolate. There's also a genetic test that we can do where we look at something called the MTHFR, which honestly, we should probably just do an entire episode on MTHFR at some point because there's enough information there to discuss. But essentially, the MTHFR is a gene that is used for a few things, but predominantly it's used to convert folic acid into the activated form, which is L-methylfolate. And so for some people, they have a deficiency in that gene, so it's not entirely active. And so for others, it's not active at all, or it's so limited that it's sort of functionally inactive. And if that's the case, then you definitely want to be supplementing with L-methylfolate, right? Because you're just not going to get that activated form. So basically what I mean when I say that is if you don't have the activated form, either through your body naturally producing it from folic acid, or you get it through supplementation, then your body can't do anything with the folic acid, right? If it is unable to convert it, or if it's able to convert it, but at such a slow rate, then it's not going to get enough. And so there's a whole cycle with a number of different molecules involved in that involve L-methylfolate. And there's a number of different mechanisms in that cycle that are related to depression specifically.
Okay. So supplements, dietary changes, anything else that you want to mention?
Yeah, just a couple things. In terms of some research that has looked at L-methylfolate supplementation for depression, one randomized controlled trials, and for those listeners, we love randomized controlled trials. These are the ones that we can have more stock into the outcomes, right? And so one by Papa Costas and others in 2012 found that 15 milligrams of L-methylfolate supplemented for 60 days improved the response to antidepressant therapy in those with major depressive disorder when compared to the control group. So that 15 milligrams is kind of key because they did a second trial that was similar to this one alongside of it, and they used lower doses, and those doses were not clinically significant. Another sort of meta-analysis that was conducted that it did include the previous trial I just mentioned, but this was by Maletic and others, and they looked on the studies available of L-methylfolate and concluded that 15 milligrams a day was the most effective dose, and kind of interestingly enough, that individuals with a higher BMI, so of 30 or above, the BMI stands for body mass index. If with a higher BMI, those individuals actually tended to respond better to L-methylfolate than those that were within sort of the healthier range of BMI. And then those that had elevated inflammatory biomarkers as well upon testing also showed to have a better response to L-methylfolate. So those are just kind of interesting factoids, if you will, regarding certain patients that might be more likely to respond than others. But above and beyond that is most likely, I would hypothesize, that people with that MTHFR deficiency that can be achieved through some sort of genetic test. And many insurances, just to put this out there, many insurances do offer a genetic test and cover it. Medi-Cal actually covers it completely, so it's free for those that are on Medi-Cal, and it's really, really easy to get. I guess I should say Medicaid too, because most of our listeners probably aren't in California.
And this is a side but related point that I know that you just referenced a study that mentioned, alongside antidepressant treatment. And then there's a prior study you also mentioned that highlighted that as well. And the side point would be, I know some people who want to take a more natural approach and say, okay, I want to do vitamins and it is good to consider, you can do this in addition to medication. Yeah.
Yeah, I think both of those, multiple things can be true at once, right? And the reason I said alongside an antidepressant is that it's just because that's what they did in this study. And we don't necessarily have the comprehensive data enough to say that L-methylfolate by itself in patients that have not necessarily been confirmed to have an MTHFR deficiency are going to respond to 15 milligrams of L-methylfolate when supplemented for a certain time frame, right? We just can't make that claim based on the limited research we have. But it doesn't mean that if you do have the genetic markers for a deficiency, and or you want to try alternatives to your antidepressant, and you're working with a with a knowledgeable mental health provider, it might be an alternative option for you to consider. If you are already taking an antidepressant and you're not super happy with the effect, or I should say, you've not achieved the full effect that you're looking for, and are not necessarily keen on maybe adding in other additional medications, like antipsychotic medications like Abilify, Rexulti, and so on and so forth, then maybe you could consider, one of the a supplement like L-methylfolate, or getting some of the other testing that we talked about today, like vitamin D and B12. And just seeing if you are deficient in those, because that may be a very useful thing useful knowledge to where you can start with what your next treatment plan is going to be.
Awesome. Well, those are the 3 that we wanted to cover today. I know for me, some takeaways are obviously to get tested, and that's important to have that awareness if this is impacting our mental health. Also, another takeaway for me is you've already provided some really basic things that people can do if they know that they're deficient. But any takeaways that you want to add to that or supplement with?
Yeah, the major thing that I would say is just try to be informed as much as you can. And obviously, our listeners are probably far more informed than the average person that's going into a mental health clinic. But if the more you can advocate for yourself with the knowledge that you have, the more likely you're going to be able to work with your provider in order to optimize your treatment plan. It's much easier, and I can say this selfishly, I actually much prefer my patients to be well-informed, because then it's easier for the both of us to make, for them to use their knowledge base and for me to use my knowledge base to come to a conclusion about what's going to be an approach that they can really get behind, right? And when somebody is confident in the approach that they're taking, they understand the reasons why they're doing what they're doing, then both the patient and the provider are going to be maybe more excited or hopeful, right, in order to follow that particular treatment plan.
Okay, well, thank you, Jonathan, for sharing and encouraging us to be aware of these things. And I'm looking forward to our next part 2. And I was wrestling, like, should we tell them what we're going to cover or just leave them hanging?
No, we want the element of surprise here.
Yes, I figured that. So we look forward to seeing you next time, or hearing us for a part 2 on vitamins and minerals and our mental health. Thanks for listening. If you enjoyed today's episode, please like and subscribe. Your engagement will help us reach more people who need encouragement. To hear more episodes, learn about our other mental health resources, or support us financially, visit thebrainpeoplepodcast.com.